But welcome, everyone. My name is Dr. Kenesha Bryant Moore. I am the director of the Faith Network, and I am a professor at the University of Arkansas for Medical Sciences in the College of Public Health in the Department of Health, Behavior, and Health Education. And so I just want to welcome you to our December Lunch and Learn. And we are actually still waiting for our speaker to come. And so we have reached out to her. I don't know if something has come up or not. But in the meantime, I just wanted to provide some updates about the Faith Network in case you are not familiar with us and the work that we do. But Crystal Jones is already also on the call today. She serves as a program manager for the Faith Network. And I see Reverend Givens on there. He's one of our ambassadors for the network. And please, if I didn't recognize you, you're part of the network, please let me know. But we have been around since 2016. Our goal really is to connect the academic community, specifically researchers, with faith leaders and the faith community across the state of Arkansas. And actually, our reach has gone beyond the borders of Arkansas to have some national impact, which also is really awesome. But our goal really is to address health disparities and inequities amongst those who don't have access to health care or have poor health outcomes or just need knowledge, just need support. And so that's what the Faith Network is here to do. And we have been involved with several projects over the years, from mental health to COVID, to chronic illnesses, it brought just broadly. And currently, we're actually in the process of doing some more capacity building and training among faith leaders and with researchers. So just last week, we wrapped up a training. It was a 2-day training, a total of 6 hours, with those who are involved in research that was interested in engaging the faith community. And we did it virtually, actually in partnership with Dr. Laverne Moore Carter, who is based out of Virginia, to provide more insight on how to engage the faith community and specifically research, but some of it actually is applicable to programming as well. And some people, have the misconception that you have to know everything about the faith community in which you want to engage. But we want to make it clear, as long as you come with good intentions, you're transparent, you're open to learning, and open to actually partnering and listening and shared leaderships, shared power, and all those things, then you can make a partnership work. And so we wrapped up that training last week, and we plan to actually continue that next year. I believe our next one is in March, but just look out for that. We'll be sending out notifications via our e-newsletter. And if you're not on our e-newsletter, feel free to email me or Crystal. I'm going to actually put my email address in the chat. And so that's how we get all of our communication out, is via our e-newsletter that goes out twice a month. The other training that we kicked off a couple of months ago is for faith leaders who are interested in being consultants on research projects. And so many of our Faith Network ambassadors who provide leadership with the Faith Network also provide consultations to researchers that are interested in engaging the faith community in some capacity. And so we want to, of course, build that network of faith leaders who can provide their expertise and knowledge when it comes to research projects and programs related to health. And so again, that one we'll be offering again twice next year. And so you can just look out in your e-newsletter for that as well for more information. And both of these trainings are free. The one for researchers, actually, we provide continuing education credit for that one. And actually, since this is still a pilot for us, you actually do get paid for filling out just evaluation forms and participating in a brief 30-minute interview about your experience. So that would be great as well. So Crystal also dropped in the chat her email address too. So she actually manages the e-newsletter. So if you want to go direct to the source, you can email Crystal as well, or if you had any questions about the Faith Network in general. And Crystal, I'm just checking in. Have we heard anything from our speaker yet?
We have not, and I have been unsuccessful in getting a hold of anyone as well. So,
oh my goodness! So I'm going to apologize. I could only stall for so long,
right?
And we had her confirmed, so I'm concerned. Hopefully, nothing has come up that is troubling that we haven't heard back from her. Yes.
Well, so I work with AR Connect now, and I did not know that Dr. Hudson was giving a presentation today until I saw the email. So I thought I'd jump on. I don't want to take her thunder or anything, but I also don't want to waste anyone's time if y'all joined and she's not able to join us. I haven't heard from her, but I'd be happy to still talk a little bit about the program, but I don't know exactly what she had entailed today. So I think maybe it's a happy coincidence that I'm on here.
Yes.
It's a very happy coincidence. And that's what we were wondering. We're like, well, maybe she sent someone in her place because I know she's very busy.
I haven't heard from her. And I didn't know, I truly didn't know she was presenting today. And I just wanted to support her. And
yes,
I'm not sure what's happened. I hope all is well, but I'd be happy to still share some information if y'all would like.
I would love it because we have some people on the call that are dedicated to improving the mental health and well-being of Arkansans on the call. I recognize names and faces, so it would be greatly appreciated.
Sure. Well, do you want me to go ahead and start, or do y'all have any other?
Sure, go for it.
Well, thanks for having me, all letting me share some information today. I'm Victoria. I'm the outreach coordinator for AR Connect now, but we are a free virtual mental health and substance abuse program here at UAMS. We were started in response to the COVID-19 pandemic back in 2020. So we kind of started in July testing it out. And then by August, we had our office staff all in place here on the UAMS campus, but everything we do is virtual. And that was written into our grant so that we could keep everybody safe during the height of the pandemic at that time. And with really, unclear what was going to happen. So everything's virtual, and we've maintained that because we're finding that we are able to provide our virtual therapy and psychiatry and resource coordination to people throughout the entire state and in these rural pockets of our state that normally weren't accessing care, either because we know that there aren't as many providers in the rural areas or because of lack of internet, things like that, or the transportation to and from, smaller areas to the bigger cities. That's very costly. So anyway, AR Connect now has really helped kind of overcome some of those most common barriers to accessing or really even seeking mental health care. So our phones are accessible 24 hours a day, 7 days a week to talk to the triage nurse team here at UAMS. And if you are in crisis, they'll help you through that situation and most likely direct you to the emergency department or to call 911. But if you're not in crisis, then they get you scheduled with the AR Connect therapists. And typically we're able to get you scheduled to speak to our intake coordinator within 24 to 48 business hours. And then from the time you complete that phone call, we're getting you scheduled with one of our therapists, typically within a business week. Now, things have been really busy for us right now. And with the holidays, it's looking more like maybe 8 business days, so a little over a week. But we are still working very hard to try to get patients and callers connected to our team, or our therapist rather, in a very timely manner. So we are able to kind of decrease that wait time that you might have upwards of like 4 months in, for some clinics throughout the state. So at least we're able to still cut down that time. But of course, we'd like it to be within just a few days. So we're working to get that back to an even shorter time. Another really important thing about our program is we are entirely free. And that's because of our grant funding from the Substance Abuse and Mental Health Services Administration. So our patients, they don't have to have health insurance. They will never pay copays. They shouldn't receive any bills. If they do, mistakes happen. It's a big institution here. So sometimes things get through our fingers, but all they have to do is notify us of that, and we take care of that. We correct that. So nobody should ever be paying anything to seek or receive our services. And in addition to no copays, no bills, anything like that, you don't have to have a formal referral either. And that's largely because we don't require the health insurance. And sometimes health insurances do require a formal referral from your PCP in order to see like a mental health specialist. And so that cuts out some added costs there as well. I mentioned that we provide virtual therapy, psychiatry, and resource coordination services. So we have a whole team of licensed mental health or licensed master social workers or licensed professional counselors, and they are able to help patients navigate whatever the circumstances may be that they are experiencing. So we can help with severe and non-severe mental health diagnoses. So anxiety, depression, post-traumatic stress disorder. Maybe you are navigating grief or job. Maybe you have found yourself without a job lately in this market, and whatever it may be, there's no issue too small for us to help you with. When in doubt, give us a call, and we can certainly help you develop strategies for healthy coping and for navigating whatever you may be experiencing. Now, in nature, we tend to be shorter term. So we tend to provide about 6 to 8 services while we kind of bridge a gap into a longer term treatment option if that's needed. Because we certainly, like we already talked about, we certainly don't want people having to wait months or weeks anyway for an appointment for somebody near them, wherever they may be living in the state. If we can be kind of bridging that gap and helping them get some services in the meantime, because your mental health shouldn't have to wait that long. So therapy, psychiatry services, we do have psychiatrists accessible to us here at UAMS, and they can help with medication management. So whether you've been on a medication prior to seeking our services or the therapist determines that one might be beneficial, we can get you consultations and appointments with our psychiatrists for medications. And then something that's unique to our program that is very useful is our resource coordinators or care coordinators. And they work behind the scenes, but very directly with the patients actually. And they do so much work to help our patients get connected to additional healthcare providers or to basic needs. We know that food, shelter, food insecurity, things like that can impact your mental health. So we're trying to consider the whole person and all of the factors that might be influencing their mental health. And if we can secure food for a family or shelter, things like that, then that might improve emotional well-being. So we can help them find whatever types of resources they may be needing wherever they are in the state. And that goes for caregivers, for example, helping them find a respite care program or a senior center near them so that they can have some time to take care of themselves, things like that. Support groups for medical diagnoses, whatever the resource is needed, you can always call us even just for help finding these resources. Even if you don't need to talk to a mental health professional, you can call just to find resources. So that's been a really helpful tool and something that kind of helps us stand apart, and we're able to offer that. It's a non-billable service if you want to be technical, about it, but it's something that we're able to offer because we're grant funded and we aren't billing for our services anyway. So we're able to provide that as an added bonus to all of our callers. I'm trying to think if I've forgotten anything. Oh, we're for people of all ages. You just have to be within the state of Arkansas. So it's really beautiful that we've been able to help people in elementary age to 80s, 90s, older adults. And so that's really wonderful. You just have to be within the state of Arkansas. And I say it that way because you don't technically have to be a resident here, but you do have to be located here at the time of the services. So as we approach the holidays, if family is traveling into town, or friends, loved ones, anyone really, and they find themselves in Arkansas and maybe they go through something, a trauma, or they need help finding resources while they're here, they can call and they can use our program. And I would encourage them to if they need anything, because we are free and they just have to be here while receiving the services. I think that, minors do have to have guardians' consent to call, but we can still provide services to minors. Their best interest is in mind, of course, of our therapists. So when it comes to providing the services virtually, sometimes it is more challenging or maybe not as efficient for younger ages to keep the best attention and have the best care by way of telehealth or televideo appointments. So our therapists will sometimes refer people maybe under the age of 12 to in-person providers that can, meet their needs, so that they get the best care, because that, of course, is what we want. But we are a very quick turnaround and provide short-term services, and we have backing of UAMS, so we're able to get a lot of referrals to longer-term treatment and appropriate care as needed. I think that kind of covers a little bit of everything. And I'd be happy to try to answer any questions.
Thank you so much. That was excellent, just to do it on the fly like that.
Thank you.
I really
Yes.
appreciate it.
Thanks.
I did ask people, if you didn't want to get off the off mute to ask questions, feel free to put them in the chat. And I realized when I dropped my email address in there earlier, I put it in the in there with the waiting room instead of the instead of this one. So I just added my email address as well. But I will start it off with one question. We do work with faith communities that are that speak Spanish and Marshallese primarily. Are those services available in Spanish and Marshallese too?
Yes. So as of right now, we don't have any therapists that speak additional languages. Everyone speaks English right now. However, we do have access to translator services. So we can provide services to individuals who are non-English speakers. We also have materials like our flyers printed in Spanish and Marshallese, because we know that we have a large population of Spanish and Marshallese speaking individuals in Arkansas. So we do have printed materials available for them. And then as far as our services go, we would use translator services.
Awesome.
It is possible.
And before I keep asking questions, does anyone have any questions that they want to ask?
I would say, is it possible, Victoria, to maybe put the contact information in the chat if someone was interested in contacting you guys?
Yeah, absolutely. And in fact, if anybody would want materials for their office, a community group, church, anything like that, I would be the one that you'd likely want to reach out to anyway, because I do all the mailings. And I often will do presentations or meetings with groups to let them know of our services. So I'd be happy to share my information here in the chat.
Great, thank you.
No problem.
And then if you have any questions, like I said, if you're too shy to come off of mute, feel free to go ahead and drop them in the chat, so Victoria can see what they are. And she just put her contact information in there as well. We have utilized their flyers in the past for the Faith Network with some of our care packages. We have a group of volunteers, also known as my kids, who pack up care packages for the Faith Network. And we did include them, some of the flyers in those care packages. And I believe we also, with some of our self-care kits, we included the information as well last year. Well, it was earlier this year when we mailed those out too. So even if you don't know anyone right now who may be in need of the service, you never know. And I think the flyer is a good way to at least have, so people have the contact information. So in case they do need it, they will know where the resource is. So I think I do highly recommend for your either work or for your congregation to reach out to Victoria, so you can at least have the information, because you never know when you may need it.
Yeah, please do. We've got flyers, business cards, posters, little magnets, for a break room or anything like that. And I've had one church, just as an example, they have like a prime timers group for older adults, and they've included the flyer in like a monthly newsletter to them so that everybody had it. And that was after I'd given a presentation to the majority of their members. But anyway, it's really useful information to have. And the flyers kind of detail some frequently asked questions that will clarify how to get in contact with us, when our appointments are offered, because our phones are open 24/7, but our therapy hours are still typical business hours, so Monday through Friday and some on Saturdays, so things like that. And who to call for resources only and how to get in touch with me. So again, I'd be more than happy to provide any materials that y'all are needing, and I can mail them to you, deliver them to you, however best works.
I know your specialty services were for substance abuse. Does this cover all substances, or is there a specialty substance abuse that you work with?
Sure. So given the nature of our short-term or urgent care type of services here, we can help patients get started with identifying the need perhaps for substance abuse treatment. So we can get them connected to a therapist to start navigating that process. But it may be likely that they would need in-person or inpatient treatment for some of that, but we would help with that referral process and provide therapy while we are doing the referral and getting them connected. So alcohol or drug use, whichever it may be, we can certainly identify that and help them get started with services.
Great, thank you.
You're welcome.
And that kind of touched on another question that I had, because I know you mentioned that the services are kind of limited as far as how many sessions you can have, and that may or may not be enough before a referral may take place. Do you know about how often the sessions will occur? So if a person identifies a need, is this a weekly thing, a monthly thing? How does that kind of work?
So it kind of is dependent on the patient and their needs and maybe even their schedule. Typically, I think it's safe to say that a lot of the therapists would prefer to start with a 1-hour weekly session. Typically, the sessions are for up to 1 hour every time, but they may start on a weekly basis. And then as you get further into it, and maybe if you're as you become more stable, if that were a concern or anything like that, then they may do it every other week. Or if they know that they are referring you to long-term and we have a wait of, let's say, 10 weeks, right? And we know that we can provide services for up to 8 sessions, then we may, after the first, 4 or 5, the therapist may choose to maybe go every other week so that we are still consistently seeing you until you get transferred over to the new provider. Does that make sense? Okay.
That does. Thank you.
Typically, it would start with 1 weekly session for 1 hour at a time.
Okay. And, another question that comes up when we talk about grant funded projects is sustainability and how long are you funded for? So we don't want to go out, obviously, and put out a bunch of flyers and come to find out, oh, the grant ended yesterday.
Sure.
So can you speak to that a little as well?
So that's a hot topic right now. And all I can truthfully say is that I know we have funding through March of 2023. So, and I know that is more quickly approaching than we'd realized. But I will keep y'all informed as I learn or as we have solutions, because you're right, sustainability is always in our mind and we're always looking for additional funding. So that's really all I can speak to right now.
Okay. That's good to know. And we will definitely follow up with you as that time approaches to see what's going on too.
Wonderful. Yeah.
All right. So I don't see any questions in the chat. Were there any other questions or comments? All right, so it looks like we're gonna end a little bit early, which is totally okay, I'm sure, with everybody. You get a little bit more time back on your lunch hour. Victoria, I cannot thank you enough for just being on here to support Dr. Hudson and then taking over. We really appreciate
I'm happy
it.
it worked out the best I could make of it.
Yeah,
No, it
and we
was-
will
it
reach
was
out to her,
great.
making sure it's yeah, this is everything that we needed. So I really appreciate it. And then we hope that she's okay as well. I've been keeping an eye out on my my
Yeah.
email too. So
Yeah.
everyone, we have been sending out the AR Connect flyer on our e-newsletter. I think, Crystal, it's been twice a month we've been sending it out, right, with the e-newsletter?
Yes, twice a month. It goes out on the 15th and the 30th.
And so we will continue to send that out as long as the program is up and running and funded. And so if you were not able to catch that information, it is in the e-newsletter that goes out twice this month as well. So Victoria, again, thank you. And thank you everyone for being here. We are not meeting again, obviously, till January. Our Faith Network Lunch and Learns will continue to be the second Wednesday of the month at noon. And so I would just want to wish everyone happy holidays, stay safe, and don't stress yourself out, because we want everyone to have good mental health leading into 2023. And if you need some help, you know where to go. Victoria has you covered. Well, thanks, everyone. We'll see you next year.
Thank you. Bye.